Right, so if you're watching this, it's a short video of the portfolio, the platform, which is, in addition to the platform, there will be tutorials, weekly tutorials and touch-based sessions. Now, this is just a demo. I'm not gone into someone's particular portfolio. I've just set up a random email address and password, but actually when you've got login details, this is what your login page would look like. So today I'm just going to show you a little bit about what a typical induction on the IED GDP foundation program looks like, which can be integrated into your practice induction or can be used solely for your induction if the practice is struggling to find something comprehensive enough for an international dentist. So let's go on to the sign-in. So this is a dentist test. That'd be your profile, you sign out. And this on the left is just generally what your main page would look like. That's your dashboard. That tells you who your mentor is, how many webinars you might have completed. Every webinar has got some quiz attached to it, just to make sure you can embed your learning. And then these are the submissions that you would make. So that could be your case-based discussions, your observations, tutorials, reflections, or any part of your educational clinical support plan that will be given to you by NHS England for you to complete and get your full inclusion for your performer number. And then any of the additional uploads, maybe like an audit you might want to upload. And then there's here just something to demonstrate your activity. So there's a snapshot at the front page. You can see what you've done recently. Then these are the programs which we'll go into. Those are the webinars that to every month there are a handful of webinars that I've created, which I think are completely relevant to primary care, to your general practice, which again, as a foundation, this is the kind of stuff that you'd really need to fully understand and be able to incorporate in your daily practice. This is a chat feature. If I go to it, this is where I'll create a chat with you and your mentor, and it just logs what we've done or anything you might want to communicate with me about, anything I might want to communicate with you about. And I also use this page after we've had a tutorial session just to set up a summary of what we did today and what we're thinking about doing next week. And it gives your mentor visibility at the same time of what we're doing together. This my upload section, there's nothing uploaded here at the moment, but if you wanted to upload something for me to have a look at or for your mentor to look at, this is a page that we could do that. I would then review that upload and give you some feedback. And then these are when we go to submitted forms for this particular dentist, Dr. Test. This is what Dr. Test has done to date. So, so you can see that, well, I'm going to give you, this is an example of just month one. There's a tutorial that's happened, and you can see that the mentor's already reviewed the tutorial, and admin would be me to give some additional feedback, see if there's any learning in that. There's a reflection, and you can see pending here, pending review, which means the mentor is still to review it and I'm still to review it and provide some feedback. And then once they are submitted, they go to reviewed submissions. This is a webinar that Dr. Test completed on NHS rules and regs, avoidance of doubt as well. So once the webinars are set up such that you can get CPD from these. There's a quiz attached to it to make sure that you just understood what you've just read, and then there's a reflection that you would do to get that CPD certificate. So if you look at that, for instance, actually we look at tutorial template. You could go, anyone can go into that, and I've just put some things in here just so that you can see what a typical tutorial template would look like, the date, the topic, the areas that you cover, the actions, your reflections on it, and the feedback that was given, the mentor feedback as well. And there you've got an export function that you can now download this as a PDF, and you could use it as a potential submission for your NHS England plan. So let's just go to programs, because this little session is just to show you what's in a typical induction. So let's go to that. Well, actually, no, let's go back. If you look at the programs, every month generally follows a similar pattern. The induction is probably the most different, but actually very relevant to all the months that are going to come after that, and also very relevant to help prepare you for your dental clinical advisor interview. If you look at here, it tells you how many modules, how many you've completed. That's just assigned to you, and how much material there is in here. It is a very heavy induction, but I am a true believer that a well-structured, kind of potentially loaded induction is going to give you a much better footing for when you see your first patient. And it's got pretty much all the guidance that I think is relevant to that very first journey. And it starts to get you familiarized with what effective reflection looks like, starts to get you, you'll become familiar with the baseline guidance and how to apply it, all very relevant. So if we now just go into there, it says click to view modules. So like I said, it is a very top heavy induction, but you can also pick and choose what you might want to do out of this, or you can just go for it and do all of it from beginning to end. And if you were to do that, I think you feel very confident starting off in practice. So there's some welcome information. This just tells you that it's a downloadable document. Values or expectations, that's something that you would do with your mentor. What do you expect out of this first year? What do they expect from you? It really does help align what you guys are thinking together. I think setting expectations and being clear from the outset what you expect from one another is probably, kind of setting professional boundaries, and it's always a really good start to the year. So then if you continue to scroll, I'm not going to go through each of these, but you can get a quick view of what there are useful links. These are guidance links, GDC standards, the scope of practice, stuff that, you've now a registrant and you've got a number. This is stuff that, it's pretty much a Bible that you should fully understand and be able to work with. That's a suggested practice induction plan. So it'll lay out what you should be doing in practice. This is just a declaration that you've kind of read and understood these things. And this is a clinical skills and knowledge induction. And what that is really practicing on some extracted teeth. So it's a checklist of, you'll do some fillings, some access cavities and extracted teeth. Your mentor will be able to give you some feedback on that pretty much straight away. So it's kind of preparing you now to do some of that stuff on a patient, but allowing you at the same time to get some feedback from your mentor, familiarize yourself with the equipment. There's crown preps in that, anterior and posterior, fillings, composites, amalgams. So it's a nice way to get yourself used to how the handpieces work in the surgery, and then your mentor will also be able to give you some pretty quick feedback to see where you are at from the get-go. And then if they feel you need to tweak a few things, then you can do more stuff on extracted teeth. So I always suggest as a starting base that your practice starts to collect some extracted teeth for you. This section is on radiography, because I'm aware that some international graduates have very little hands-on experience with practical radiography. So you can see the latest guidance in that. There's a tutorial on practical radiography, how to use the holders before you use it on a patient. And then that radiograph log sheet is literally you and your mentor observing, say, the first 10 films. This aspect you will find probably on your NHS England plan, and your clinical advisor, dental clinical advisor in the interview will ask you about, what have you done with radiography, and you'll be able to demonstrate that you've got some experience on that. Prescribing, another section that I think is really important. A lot of people, once they've got their GDC number and they're awaiting their performer number, do start in practice privately. And if you start privately, then you really need to know what a private prescription would look like. Script is an e-learning platform, very, very comprehensive, probably one of the best ones that you can do to make sure that you fully understand and are aligned with the use of antimicrobials, and it gives you an overview. You'd have to create a login for that, you have to access it, but it gives you a step-by-step guide on how to do that. Section 6 is about caries management. Lots of documents here to read and understand, and then a reflection to demonstrate that you've read and understood that. Some of this you can do away from the practice. So the nice thing about this induction is you can start it pretty much ASAP and start to do some reading, reflections, understand caries, how that's managed. This section is on perio, similar setup to the caries, understanding the latest guidance. It's all here at your fingertips, and then reflecting upon that. This is a checklist. It's a competency checklist, which actually is in 6, but I tend to put it in the induction so you can see what's expected from you within these kind of, expedited 6 months of learning. What is it you'd be able to use and demonstrate professionalism, your communication skills, your clinical skills, your management and leadership skills. So I put it here in the induction just so that you can say, well, yeah, this is what I'm kind of working towards. And that competency checklist is also full of things that NHS England are likely to be asking from you. So as you can see, we're already starting to work on that. This section is preparing you for the application and the interview, and it's like a step-by-step guide here on what the things that you need to be aware of and how to apply. And then this section, I know also some international graduates don't really do reflection as undergrads or even as postgrads, and reflection is a big part of being a GDC registrant here. So it tells you actually what is reflection. It's not just a summary of the event that you've now just encountered. It's really a way of cementing your learning from that event and how you're going to apply it. So there's a section on reflection there. And then at the end of every month, you're going to see a section on the webinars. So this is telling you to go to the webinar section and complete the webinar on equality and diversity, the resource documents, and to complete some reflective statements on that to evidence your learning experience. So let's just go to complete this for the webinars. And here it's all set up. So you see induction, month 1, month 2, so on and so forth until you get to month 6. So this is just an introduction video on how to use the portfolio equality and diversity. So if you went into start webinar, you can see that there's a PowerPoint presentation, and then you would start the quiz, and you need to get 80%, maximum of 3 attempts. Then you'd have to redo the webinar if you couldn't score 80%, and then there's a reflection to complete. Once you've done that, I normally ask the dentist to send me a notification in the chat feature to say that you've completed a webinar on equality and diversity, and then I can issue your CPD certificate for that. So that's just a very quick run through the induction. The next webinar that I'll be doing for you here, presentation, is just on a typical month, and I'm going to show you what a month 1 would look like, and then I'm also going to show you what a typical ECSP would look like, because regardless of which region you are in, the plans that NHS England set are very, very similar. And I've incorporated probably close to 90%, I'd say, if not all of it, into these months, and into the induction. Just a couple of things on this dash page. This is a resource page which you would have access to, and here it's just got additional templates that you might find useful, guides, training modules, recommended tutorials, templates for recommended tutorials that you and your mentor can use. A lot of this is, again, what NHS England would expect you to know as part of your plan, but also I've incorporated things from my own experience and what I used to use for my own learners in my own practices for the FDs, and what I've used in the past just as learning material for any mentoring that I was doing. And I believe these tutorials, if you can cover these in the first year, it gives you a very good foundation to now kind of work completely, more or less independently. There is also a learning needs plan section here. This section, if there's a learning need that's been identified by your mentor, or even by me, we would use this part to set out what that learning needs is. How do we want to box that off? What resources can you be given to help you close that learning need? So it's almost like you're going to go full cycle, and anything that you are struggling with, and it's going to be structured, transparent, and easily accessible for me, for you, and for your mentor. So all of us can be engaging electronically. You'll get feedback at practice. You'll get feedback from me. We'll have that as regular touch-based sessions as well. Okay, so I hope you find that useful. And like I said, there'll be another one coming just to demonstrate what a typical month would look like, and also to demonstrate what a typical educational clinical support plan and agreement might look like.